Am I audible?
Yes, yes. Dr. Samir?
Yeah.
Good morning. God, Dr.
Good morning to all of you, sir. Uh, at the outset, we are almost ready. I will try to express my gratitude to the society for giving me this opportunity, and a big thumbs up to Dr. Mayank Panti for providing such a nice facility here.
And we like the fact that
Today I am going to implant uh, no, extend. It's an extend toric. It's a trifocal EDOF lens with toricity. So basically, the EdTech there are three important features that it provides. Am I audible?
yes, you are audible, Dr. Samir.
The most important thing about it is providing the trifocality. They are distinct ads at 1.5 and 3 diopters. And second thing is that it provides a continuous vision. And other thing about it is that it has got a apodized, first phase apodized diffractive optics. That is something peculiar about it, and that gives a very balanced light distribution in scotopic, photopic, and in all the light conditions. It provides a very, very balanced distribution of light between in the intermediate and near zone in all the light conditions. So the good thing about it is that this lens tries to counter the problems of normal multifocals. The first problem that is there is about dysphotopsia. So this lens doesn't have got sharp edges on the optics. So that helps to mitigate the problem of dysphotopsia. And the second thing about it is the first phase apodized diffractive rays, they help in a very good transmission of light. So it is about, the MTF is about, the modulation transfer function is very good, and it is about 93%. That is very close to a monofocal lens that provides about 95%.
Wonderful. Can we start off with the surgery, because 11:30 we have to move transmission to Bangalore, and we have to finish 2 surgeries. So yeah. So I heard about the lens that it's a trifocal and EDOF. Is it something like the Synergy lens?
Something like Synergy lens, yeah, right. Something like Synergy lens, because together with providing the ads at the near and intermediate, it is also giving a continuous range of vision.
Wonderful. And it comes as a toric as well, as you said.
Yeah, it comes as a toric, and the toric has got a special feature that has got the left lock haptic feature that helps in proper stabilization of the lens.
Wonderful, Dr. Samir. So what Dr. Mayank, can you give us details about the patient as well? Like what is the...
I have already done, because she is about I think 67-year-old lady. She is a retired government servant, and she came to me with a very specific demand that she doesn't want to wear glasses after surgery. But she is not very much adamant also. I told her about she may require glasses even after multifocal. So she told her it's okay, she just try. So she is a very good patient for multifocal. I have already done one toric toric extend in one eye, and now I am going to do the same lens in other eye.
Wonderful.
She has got a astigmatism of 1.5 diopter, and her vision is uncorrected is 624. With correction is 612.
Great. So Dr. Mayank, also can we have the other patient kept ready so that the transition time is shorter? Great.
Lawan, I think thorax placement is at 3 degrees, so it's almost right में देख लीजिए. And then again mark and ready. Right. But.
Dr. Mayank, can, if there is the option of a second microscope and table as well, can you have the other patient be ready? And, you know, maybe even the Rexes can be done, because, you know, there will be always, there's going to be a shortage of time. So maybe Dr. Vipul can start his surgery on the other place. And, huh? And it's a wonderful feeling that today for this surgery session, we are having several surgeons from our state of Uttarakhand also operating. It's a very nice feeling. For us, it is well focused. If you want, you can start. I mean, if your focusing is correct. So Dr. Sameer is a very experienced surgeon, supposed to do very brilliant surgery, and has been practicing at Haldwani for almost 15 years, as I would think.
अच्छा समीर वर्मा उसके बाद विपुल अरोड़ा.
What was Dr. Frankie, then focus.
Yes, sir. Yes, sir. It is nicely focused. So you are going to do stop and chop, sir?
Yeah. I am finding it difficult to focus. No, no. That's right. It's okay, it's okay. Fine. Huh? Paper two.
Very nicely done, sir. हाँ. फोकस उतना अच्छा नहीं है सर, थोड़ा सा हाँ उसको भी दिक्कत हो रही है. रेड ग्लू भी नहीं आ रहा ना पीछे से.
So, Dr. Mayank, what is the astigmatism of this patient and what PAR lens are we planning to use?
दो मिनट और नहीं आगे हूँ.
So normally you use coaxial or bimanual, Dr. Sameer?
I use coaxial normally.
Okay.
And by default, I almost always use 2.8 because I have an habit of, because my 60% cases have about 0.5 to 0.75 diopter astigmatism, so I try to counter it with my placement of incisions. So mostly I use 2.8 so that I want to create some sort of astigmatism to counter it. So I am here also using, because I am used to it, so I am using 2.8 only. Huh? What was the next?
So what is your cutoff for using toric IOLs?
Toric IOLs to give a metropia to the patient? Cutoff, acha. My cutoff is 1 diopter. About 1 I do counsel the patient. Below 1 I try to counter it with my incision site, incision locations. Above 1 I
Go ahead with the injection, and I think the second surgery will now have to wait till lunchtime because the time is almost going to be up, and we have to move to Bangalore at 11:30. So, as a reserve, we'll operate the second case during the lunch break. So that was pretty smooth. Is your incision size about, is it 2.2 or 2.5 or something? 2.8? Right. Can we enhance the retroillumination in some way, because we are not getting a view of the... Which microscope are we using here? I think somebody's mobile phone is close to some mic. Okay. So do the serrations on the haptic cause a problem in dialing, because they seemed quite significant, those... Okay, but the stability in the bag is pretty good, it seems, because... So, do all their lenses come with the same kind of a haptic, Dr. Samir? Do the monofocal and other monofocal toric lenses also have the same design on the haptic? Wonderful. And is this a hydrophobic lens? It looks like a hydrophobic lens to me. Great. So I think in 3 minutes we will be moving the transmission. If there's anything that else that you would like to tell us quickly, we please go ahead.
So in my experience, the thing is that it tries trifocality, the multifocality, and together with that, it tries to mitigate, because I haven't found any problem regarding the, till now, although my experience is quite short, but till now the main problems that are the scatopsias and the glare problems and the contrast problems, I haven't yet encountered any complaint. So it's doing a good thing, good job. The only other thing that remains to say is about the multifocal lenses, that they are very demanding in the sense regarding the hemitrachea and the pupil, and regarding the centration and all those things. That I haven't checked yet, how much for giving this lens is regarding those things. But otherwise it's quite good. So the cortex is now in which right. Okay.
So that's wonderful. What is the range of intermediate and near vision that this lens gives? Like, what is the nearest and what is the far for the intermediate?
So check the near is 30 centimeter almost.
Okay.
And it's quite good. I have checked the reach of the cell and it's quite flat. Means from about 30 centimeters with the refocus of about 2.5 diopter also. It's about 612. The best vision that I get is 612.
Great, great, wonderful. So excellent job, Dr. Samir. And is Dr. Mayank there? Then I'll just kind of request him to have the case ready. We'll try to accommodate the second case during lunchtime. The lunchtime is likely to be at about 1:45 p.m. And please have the case ready at that time. You can keep following us on the live surgery channel, I mean the YouTube link that we have, so that you are aware of when the transition will happen.